In recent decades, the Internet has revolutionized access to medical information for scientists, health professionals, and patients alike. For the general population, finding reliable information is challenging, in part due to the abundance of scientific jargon and to competition between reliable and misleading or erroneous information. This is especially true since the emergence of social media, where the spread of misinformation is facilitated by information silos and personalized feeds inducing confirmation bias. 1. Large language models, LLM, a type of artificial intelligence, AI, system trained on massive amounts of text, provide an exciting and novel approach to information research, with automated summarization, multilingual support, and improved search with understanding of the context and meaning of queries. Recently, a research version of the third version of a conversational AI language model named ChatGPT was released and captured wide attention. ChatGPT was trained using text from a wide range of Internet sources, including web pages, books, and news articles, which were pre-processed and filtered to remove low-quality content, spam, advertisements, etc. Nevertheless, the adequacy of medical information provided by ChatGPT remains unclear. We qualitatively evaluated the relevance of ChatGPT for a wide range of medical queries. We created 99 arbitrary questions on medication management, pre- and post-intervention management, lifestyle recommendations, and more general disease information. Most questions were related to cardiology and cardiovascular disease prevention, as this is the clinical experience of this research team, and some questions were preceded by an explicitly false statement, for example, vaccines are dangerous. When appropriate, ChatGPT was asked to cite its sources. Each question was independently posed to the online ChatGPT interface by 4 trained physicians. Responses were collected and evaluated according to several criteria: perceived risk of misinterpretation, potential medical risk associated with the answer, quality of the sources used, and a qualitative score with a pre-established linear scale. The process was then replicated in French to assess the impact of language on sources used and information quality. Finally, because the 4th version of ChatGPT was released, questions were asked again to the new version of the model. Assessment of the quality of medical information provided by ChatGPT across 99 medical questions. For the 99 questions, the mean grade was 4.5, with an interquartile range from 4.25 to 4.75, with only 4 answers having a mean grade less than 3. 70 were rated 4 or 5, correct or perfect answer, by all 4 physicians, and 91% were rated more than 3. On average, 13% of the answers were deemed possibly misleading by each physician, and 2 were misleading, with only 1 answer considered misleading by all investigators. This led to a potential or definite medical risk for patient harm in, respectively, 5% and 1% of answers on average, with consensus from all interrogators on the definite risk associated with 1 answer. The question pertained to duration of aspirin therapy after coronary stent implantation. Despite quoting the U.S. guidelines, ChatGPT confused P2Y12 inhibitors with aspirin, leading to a potential risk of stent thrombosis for patients. It is worth mentioning that each answer from ChatGPT included a standardized disclaimer sentence explaining that ChatGPT was not suitable to give medical advice and that medical decisions should be made in consensus with healthcare professionals. Sources used by ChatGPT were relevant when asked in 99.1% of questions. In 31.6% of cases, they were scientific articles, and in 68.4% they were information from either scientific societies or large medical clinics, or well-recognized healthcare structures. Results were similar when the questions were asked in French, with greater reference to European guidelines. Results were similar when the questions were asked to ChatGPT-4, with a median grade of 4.5. Several conclusions can be drawn. First, ChatGPT provided mostly accurate answers to basic medical questions, relying primarily on scientific data. Answers and sources were quickly acquired, with a systematic and appropriate warning about the need to consult a physician before making any health-related decisions, and about the inability of ChatGPT to provide personalized care. Second, although some responses were incorrect, ChatGPT did not convey major medical misinformation, even when suggested in the question. For example, COVID is a hoax. ChatGPT reports the current dominant consensus on medical topics. This confirmation bias is well known in LLM, with a tendency to generate responses that confirm pre-existing beliefs. This, nonetheless, might be a good approach to medical information for uninformed patients, and a safeguard for medical information. There are limitations to our study. First, it is important to note that ChatGPT is explicitly not intended for medical purposes, as stated in each of its responses. Second, other LLMs were not tested, and results might vary according to the data it is trained on. This is also true for newer versions of ChatGPT. ChatGPT, as all LLMs, is subject to bias such as demographic bias, which will inadvertently learn and replicate stereotypes and possible prejudice about certain demographics. Questions were posed and reviewed by physicians, making them subjective in nature. Evaluation and understanding of medical information provided by ChatGPT by patients remains to be tested. References were systematically asked that might have influenced the answer from the model. Finally, this was a descriptive analysis with no quantitative objective analysis of ChatGPT answers. Overall, the rate of erroneous answers and misleading statements by ChatGPT was low in this analysis. It provided understandable, well-documented and convenient answers to simple medical questions. It also helped understand medical abbreviations and terminology and clearly explained medical procedures. It can, however, still produce incorrect answers despite accurate references, which led to one 99 answer with significant medical risk. It should therefore not be relied upon as a substitute for professional medical advice. Nonetheless, our work suggests that interactive AI trained with LLM may play a role in patient access to medical information and be a barrier to gross medical misinformation. However, it is important to note that the current analysis is insufficient to draw definitive conclusions. The growing use of such tools highlights the pressing need for regulators and healthcare professionals to increase patients' understanding of its current limitations.